We've all been swimming in this massive hype wave around generative AI, but let's be honest, the initial buzz is starting to quiet down. So today, we're going to cut right through all that noise and talk about what's really next for artificial intelligence in healthcare. We're going to explore why that first wave of Gen AI didn't quite deliver on its promises, and more importantly, where the real, tangible value is hiding. To start, let's just look at the numbers.
And the stakes here? They really couldn't be any higher. According to Gartner, AI spending in healthcare is on track to just skyrocket, hitting an incredible $19 billion by 2027. Now, with that kind of money on the table, we have to get serious. We have to move past the flashy demos and start demanding a real, measurable return on that investment.
And this, right here, is the heart of the problem. Despite all that spending, there is just so much confusion. Seriously, if you ask 10 different healthcare leaders what AI really means, you are probably going to get 10 different answers. This lack of a clear, holistic understanding is what's holding the entire industry back from unlocking what this technology can actually do. So here's our game plan for today. First, we're going to break down the 5 fundamental flaws of the generative AI that we're all talking about. Then we'll shift gears and look at the rise of a much more powerful approach: AI agents. We'll see how they work in a real-world healthcare setting, and finally, we'll put all of this into a new AI maturity model to see where we're all headed. Okay, so to figure out where we're going, we first need to be brutally honest about where we are right now. So let's dive into the built-in limitations of the generative AI models that have been getting all the attention. So take a look at this. It looks almost too simple, right? A person asks a question, the large language model, the LLM, does its thing, and it spits back a single answer. Well, this incredibly simple linear process is actually the root cause of its biggest weaknesses.
The first flaw, and you could argue it's the most dangerous, is what we call hallucination. This is where the model literally just makes stuff up, presenting complete fiction as hard fact, and it does it with total confidence. Now, in some fields, that's just an annoyance, but in healthcare, can you afford for your clinical support tool to just invent a fact when a patient's life is on the line? The answer is a hard no.
Next up is AI bias. See, the problem is that these models learn from these huge, unfiltered datasets from the internet, and in doing so, they soak up all of our existing societal biases. This is a huge problem. It can lead to inequitable recommendations or diagnoses based on things like a person's race or gender, and that is just unacceptable if we're trying to provide reliable and fair care to everyone. Then we've got this issue of non-determinism. What that means is you can give a model the exact same prompt, word for word, twice, and get 2 completely different answers. Think about that. That level of unpredictability and inconsistency makes it almost impossible to rely on these things for critical, repeatable jobs like making a diagnosis. We absolutely need reliability, and this model just can't guarantee it. Security is another massive red flag, because these models are just recognizing statistical patterns in language. They don't truly understand it. They're wide open to something called prompt injection. You can think of it like a phishing attack, but for an AI. A bad actor can use a tricky prompt to fool the model into ignoring its own safety rules, which creates a huge security nightmare. And finally, when you get right down to it, for all the hype, the actual use cases in healthcare have been pretty narrow. I mean, sure, there have been a few smash hits, like ambient listening tools that can transcribe a doctor's conversation. But outside of that, Gen AI has really struggled to handle the complex, multi-step, messy workflows that are the reality of modern healthcare. The bottom line is, we need a better way. And that brings us to the really exciting part, the solution. We are moving beyond simple Q&A bots and entering a whole new era. This is the era of AI agents, a completely new and way more powerful way of thinking about and deploying artificial intelligence. So what exactly is an AI agent? The easiest way to think about it is as a specialized autonomous doer. It's a focused piece of software designed to execute one specific job and do it well, like scheduling an appointment or processing a patient referral. It's not just answering a question, it's actively performing a task. Okay, so if an AI agent is the doer, then Agentic AI is the conductor. It's the brains of the operation. You can think of it as the operating system that coordinates a whole team of these specialized agents. It gives them the ability to reason, to plan, and to work together to tackle much bigger, more complex goals than any single agent could ever handle on its own. This analogy right here is probably the best way to understand it. The Agentic AI is the operating system on your smartphone, your iOS or your Android. And those individual AI agents, they're the apps. Each app is designed to do one thing really well, but it's the operating system that lets them all work together, share information, and create a powerful, seamless experience for you. All right, this all sounds great in theory, but what does it actually look like when you put it into practice? Let's make this real and look at a concrete healthcare example, managing the health of an entire patient population. Take a look at this workflow. Right there in the middle, you've got the Agentic AI operating system, acting like a quarterback, and it's coordinating this whole team of specialized AI agents, where each one has a very specific job to do. Working together, they create this seamless, automated system for managing population health. Let's break down what each of these agents does. So, it kicks off with a digital front door agent. This gives patients 24/7 self-service for basic things like booking a visit. When needed, a patient referral agent kicks in and it automatically handles the process of connecting with specialists. Then a care management enrollment agent can actually call high-risk patients and get them enrolled in important care programs. And finally, a care gap closure agent is constantly scanning for patients who are overdue for screenings and proactively helps them get booked. See, each one is an expert, all working together perfectly. And the value this kind of system creates? It's immense. We're talking about a huge boost in clinician productivity. We're talking about lowering the terrible burnout that so many care managers are feeling. We're talking about real hard savings by preventing avoidable ER visits, maximizing payments in value-based care models, and maybe most importantly, a dramatically better experience for the patient. This is where the real ROI is. So let's zoom out for a second and put this all into a bigger context. This shift that we're seeing from simple generative AI to this more sophisticated agentic AI, it really represents a clear step forward in the maturity of artificial intelligence as a whole. You can think about this as a four-stage journey. Most of the Gen AI tools that we see today are stuck over here in stages 1 and 2, augmentation, where it just answers a question, and maybe prescription, where it offers a suggestion. But the real transformation, the game-changing value, that happens over in stages 3 and 4, automation and true autonomy. And agentic AI, well, that's the bridge that gets us there. It's what allows us to go from simple tools to truly intelligent systems that can run entire workflows. Which brings us to one last, pretty provocative thought. As these agentic systems get more and more autonomous, what does that really mean for the future of medicine? I mean, imagine a Dr. AI radiologist that can autonomously scan and diagnose thousands of images in the time it takes a human to look at one. Is that technology our future colleague, working alongside us to make us better? Or is it eventually our replacement? That's the big question we all need to start thinking about as we move beyond the hype and into the truly transformative era of AI.